I've really been thinking about this a lot recently, and it's kind of changing the way I look at skincare. Is it really possible to have acne no matter what your skin type is, like dry acne or sensitive skin acne?
Yes, and this is the most misunderstood thing about acne.
Acne is a condition. Your skin type is your biology. It is partly genetics, partly skincare, lifestyle, hormones, and everything. So sometimes they don't match.
Right.
They are independent of each other.
Okay, that makes a lot of sense.
Hi everyone, welcome back to Garden Wellness Check-In. I'm Khaw, garden pharmacist and certified Derma Expert. With me again is dermatologist Dr. Cheng and skincare lover Emily. In the previous episode, we talked about why acne happens. Today, we are going deeper into what actually helps, based on your skin type, your lifestyle, and your real skin habits.
So I've been wondering, there are different kinds of skin types and all of them can be affected by acne. So if that's the case, then how does that affect how we treat those different kinds of acne?
The treatment will be different because your skin dictates how the acne will behave and also how certain ingredient reacts to your skin as well.
Right, so it's not just about oily skin, it's not just oily skin sufferers that suffer from acne.
Yes. So when you have oily skin, right, the oil can easily clog the pores and causes acne. But for people with dry skin, the dead skin cells on the skin surface can also clog the pores and cause acne as well. And then we have people with sensitive skin type who easily turn red, itchy, irritated to skincare products that other people don't turn red to. And of course, there are people with combination skin. They have like 2 or more of the above.
There's no one single routine that suits everybody. You treat acne based on 2 things, your skin type and also the type of acne that you're having.
Right.
Let's talk about ingredients, but this time properly matched to your skin type. Number 1, oily or congested skin.
Let me guess. Salicylic acid?
Yes, for oily and clogged skin, salicylic acid helps to keep pores clear. You may want to consider niacinamide for oil control and occasional clay cleanser or mask to reduce shine. Not to forget your lightweight gel moisturizer so that your skin doesn't suffocate.
Don't forget sunscreen as well. In our Malaysia hot weather, either choose lightweight cream or light gel type or fluid type so that it doesn't clog the pores.
Yes. Number 2, dry and acne-prone skin.
Now this is what gets me. How does dry skin get acne?
Well, we mentioned earlier that dry skin has this rough surface sometimes, and there will be dead skin cells that might clog the pores. So once the pore opening is clogged by the dead skin cell, the oil underneath can't come out. That's where the bacteria grow, the inflammation happens, and you get all the pus and cysts, etc.
Yes. For dry acne, you'll need gentler ingredient like azelaic acid or low-dose retinol, not daily at first. Again, niacinamide and ceramide to repair the skin barrier and a hydrating moisturizer to fix the dryness.
Right, so for dry skin, you can still break out because it's trying to overcompensate.
Exactly. So for dry skin, you need to fix the hydration and choose a gentler ingredient to fix the acne. Number 3, for sensitive or redness-prone acne. People who have sensitive or acne-prone skin tend to react to everything. So it's best not to do too many things at once.
Yes. So if you have very sensitive skin, it's safer to go for gentle ingredients like the azelaic acid, the Sipka, or like the niacinamide. And of course, try to go for fragrance-free and also avoid those very strong exfoliant, which might dry the skin further.
I have really sensitive skin as well, and when I try too many products at one time, my skin goes crazy. But I found out that azelaic acid is actually one really good one. It was a game changer for me. It stopped my breakouts and controlled everything. So I'm very thankful to whoever on TikTok recommended me that.
It is also safe for people who is pregnant and breastfeeding.
Number 4, combination skin. Combination skin is the trickiest. You can't treat everything the same. Different routine for different zones. Salicylic acid on the T-zone, low-dose retinol or azelaic acid on the jawline. And remember, hydrating layer in between and sunscreen for overall protection. And number 5, we have the deep inflamed hormonal-ish acne.
This I know something about. I mean, those breakouts that come before that time of the month, it's just big and painful and just next level.
Yeah, these lesions are often deep. Yeah, and sometimes you might need oral medicine as well.
For this, we usually start off with benzoyl peroxide as spot treatment, retinol for long-term control of the pores, and not forgetting oil-free moisturizer. Be consistent with your routine and always use sunscreen to reduce inflammation.
Yeah, you just said that they are deep and big, right? So it's going to take time for all these topical agents to work. Definitely not within days. It might take weeks or even months.
If you're unsure of your skin type, you can drop by Guardian for a skin health check. Let us give you a personalized advice based on your skin.
Okay, I really need to ask this because in my world, everyone is doing everything right now. We've got facials, we've got peels, we've got lasers. How do I know if all of these treatments are safe or not?
Yes, we get this all the time. Let's break it down to the 4 things that Malaysians ask the most.
Let's start with extraction. So it feels really good, sometimes painful, but very satisfying to see everything, all that gunk just come out.
Yes.
Is it okay to do?
It can help, especially for blackhead, whitehead, or stubborn clogged pores. But the key word here is gentle.
Yeah, if you go too aggressive, right, you might actually rupture the skin surface, and then you might create things like scar.
Okay, so just make sure to tell the facial lady, don't be too aggressive.
Exactly. Light extraction is okay, and it works best if you accompany it with salicylic acid or a low-dose retinol just to keep the pores clear.
Okay, let's go a step further. I've seen a lot of people do chemical peels as well, and they sound really scary, honestly, and I've heard that they hurt. Are they safe or not?
Not at all when it's done properly. A chemical peel gently exfoliates the top layer of the skin, and it helps to remove clogged pores, blackheads, and even lighten up uneven skin tone.
In Asian setting, go for superficial skin peels, and also it is important to do it at the right settings. You know, chemical peels that are professional ones should be done in clinics or hospital, not DIY home care, that kind, you know.
It does sound too scary to do at home, right? And it seems like a chemical peel can almost reset your skin.
Yes, a control reset.
So now, what about if I take it a step further? I've been really interested in this. What about lasers? There are so many different kinds. Are they safe or are they just too much for the skin?
You're right about there are many types of lasers. Yeah, so there are certain lasers, they are actually targeting at reducing inflammation and treating the active acne. But at the same time, there are also lasers that targets at reducing pigment. For example, pico laser. So these are lasers that target at reducing the pigmentation left by acne, which are the brown or the black marks. So they are generally quite safe. At the same time, there are also fractional lasers. These are lasers targeting and treating the scars, the box scar, the pit scar, the rose scar, etc. So these are deeper lasers where they give you a controlled damage, aiming to resurface your skin and make it smoother. Yeah, these are the important type that need to be done properly. Yeah.
They sound a lot stronger than the pico lasers.
Yes, yeah, but giving a good hand, it will give you good results.
And after any aesthetic treatment, your skin will tend to be more sensitive. And it's best to avoid strong actives and remember to use sunscreen to allow the skin to heal properly.
So it's not just about the treatment, it's also about the post-treatment care.
Yes, aftercare is half the result. So it's important to opt for Derma brand which specially cater to sensitive skin by focusing on barrier repair, intense hydration, and sun protection.
Okay, so I'm going to move on to a question I'm really curious about. I've actually tried this before, but then I was told it wasn't a good idea back then. Oral medication. Is it safe? Is it not?
We use oral medicine a lot. And in fact, oral medicine is probably the fastest way to get those deep ones with fast and painful. And if you have recurring acne, yeah, treat it hard, hit it hard before you leave any scars that is permanent on the skin.
Right, so it's definitely something that's very effective, but maybe more of a last resort?
I would say it is probably the first line for those with inflammation, with pus, and deep cystic type that tends to give you scars.
But it's not for everyone, and it's strictly prescribed by dermatologists, and only when topicals aren't working.
Okay, so for most people, you would recommend using gentle treatments first and then moving on to oral medication.
Yeah.
Yes, it's a stepwise approach rather than jumping straight to the strongest one. Before we close, we need to talk about something extremely common, back acne or back knee for short.
Yeah, acne is really common. Actually, it happens to more than half of the people who has acne.
Is it really more than how? I've never noticed.
No, it's very common because our back and chest has higher density of the oil gland. When you sweat, the pores get clogged up a lot easier.
Yeah, and also in Malaysia's hot and humid weather, right? We
Yes.
sweat a lot,
Yep.
especially after gym, after all the pickleball games and all these
Yes.
outdoor activities. Yeah, the friction with the clothes, if you wear tight clothing.
Yes.
Yeah, the trapped sweat and heat will all cause acne.
I mean, it's the same concept as masni, right? Sweat,
Yeah.
humidity, friction. I
Yes.
honestly thought it was just shampoo.
Yes, shampoo and conditioner residue can play a role, but it's usually due to a mix of sweat, heat, and also friction. Here's what helps with back acne. Number 1, shower after sweating. Number 2, wash hair first, body last. Number 3, use a salicylate body cleanser a couple of times a week. Number 4, wear loose clothing, especially after workout. And number 5, keep long hair off the back when exercising or sleeping.
I mean, there are over half of the acne sufferers who suffer from acne. I'm sure this must be very frustrating.
Yes, exactly. It's so common, but it's also very treatable. So there's nothing to be embarrassed of.
Yeah, but back acne also responds slightly slower to treatment. The progress takes time. So it's very important for them to be consistent and along the way, celebrate every small wins.
And whether it's a facial acne or a body acne, if it becomes painful, keeps spreading, or just isn't improving, that's your sign to seek proper medical care. So before we wrap up, Emily, what's one thing we'd like to share with our audience who are on their own skin journey?
I think one of my main takeaways from this entire journey is that just because you have acne doesn't mean you're doing anything wrong, with what you eat or what you put on your skin.
Exactly.
It's something that takes time. And I think learn about barrier repair is advice that I would give to my old self. Learn from the experts how to treat your skin the right way. If you have combination or acne sensitive or dry skin, that all makes a difference. And one really important thing that I didn't realize when I was younger is that the proper skincare, the right products to use on your face don't have to be expensive. There are super affordable options out there and they could work perfectly on your skin.
Don't let acne decide your worth, your confidence, or how beautiful you are.
Yeah, there will be up time and down time. The progress takes time. So it's important for acne sufferer to celebrate every small wins along the way.
Yes, consistency beats perfection, and healthy skin is beautiful skin. If you're unsure which ingredient matches your skin type, drop by any guidance store with a Derma Expert. We are here to help you understand your skin better. And thank you for joining us on Guided Wellness Check-In.
Thank you so much for having me. I learned so much.
Thank you for having me as well. See you on the next episode.
We hope today's episode helps you make smarter, safer, and more confident skin decisions. And until then, take care of your skin and be kind to yourself.